Welcome to GreenTV, produced by the St. Joe Valley Greens in South Bend, Indiana. Our country desperately needs a universal health care system. Greens advocate a national health care system now and since our founding. Too many of our citizens have no health insurance and no primary health care. Secondary health care is less accessible and affordable than ever before. Hospitals are abandoning urban centers for the suburbs. The working poor are underinsured. Middle-class citizens have less disposable income each year because they pay an increasingly larger portion of their income for health care every year. Small businesses are pressed to provide any health insurance at all, much less adequate health insurance. Larger businesses are forced to raise premiums or lower health care coverage every year. Worse, U.S. citizens get less for the health care dollar than citizens in other industrialized nations. The health of U.S. citizens ranks lower than other industrialized societies, and our life expectancy is lower too. March 4 was National Healthcare Action Day. GreenTV filmed speakers at the local rally held at the United Steelworkers of America Union Hall in Mishawaka, Indiana. Please listen to the speakers' arguments. It is time to elect candidates to government who are committed to spending our tax money on an effective national health care system. It is time to demand government legislate a universal health care system for our citizens. This is Tom Brown for GreenTV. Think globally, act locally.
We're here today to rally for universal, affordable, accessible health care for every American. In this great country of ours, with all its wealth, its citizens should not be forced to choose between medical care and food. We should not have to choose between prescription drugs or paying the mortgage and rent. We should not be forced to choose between maintaining our standard of living or having an underrated, overpriced health care plan from our employers. Many of us worked our entire lives and deferred wages throughout our careers in order to secure our medical benefits in retirement. And we have seen those medical benefits, even though we already paid for them, snatched away by bankruptcy courts or by cold calculating employers out to increase the bottom line. There are those in this society that tell us that the marketplace will resolve this healthcare crisis, that we should just let the free enterprise system work and all will be made well, that then there will be competition for our healthcare dollars, and our choices will make medical care and prescription drugs cheaper. Well, we workers are the bedrock of American society, and we want to make some other choices.
I'm just so grateful for the opportunity to be with you all, because this is where I get the energy and the spirit to fight on every day in this election. This is not just any election. It really isn't. This is sometimes, and Carl has heard me say this before, but it's so true. Sometimes you choose the moment, and sometimes the moment chooses you. The moment has chosen us. We fought many battles, and right now the lines are drawn, and we're in the biggest battle of our lives. We're in the battle to even be able to retire, to not have our pensions taken from us, to be able to get prescription drugs at a decent price, to get health care without being completely bankrupted. I was at St. Adalbert's 2 weeks ago at a pancake breakfast, and a lady looked at me and she said, "Joe, I just got out of the hospital. I own my home here on the west side I worked my entire life for. My entire life. It is all I have, along with a little bit of savings. I just received from the hospital a medical bill for $300,000. And then she looked at me and laughed and said, "So I'm eating my pancakes quick before they get them from me." That's not right. You shouldn't lose your home and what little savings you might have been able to accumulate after working hard your entire life because you got sick. It's wrong, and the system has to change. Thank you very much.
SOAR, the Steelworkers Organization of Active Retirees, is an affiliate organization of the United Steelworkers of America with over 65,000 members and over 225 chapters throughout the United States. Our purpose is threefold: to help our communities, to advance the policies of the United Steelworkers of America, and to engage in political and legislative action. SOAR is affiliated with the Alliance for Retired Americans, the only all-inclusive retirees organization in the United States endorsed by the AFL-CIO. The only one, not AARP. We're trying to disengage from that outfit as much as we can because they're more than anyone else responsible for this stinking rotten prescription drug bill we got. That will not help anybody. That will not help anybody in this room. Not one person in this room. See, I did it again. One of the reasons for the Constitution of the United States being written, and the reason it was established, was to establish justice. Remember when we had to memorize that for high school? Now let me ask you a question. When our government fails to enforce trade laws by allowing illegally dumped foreign steel into this country, resulting in more than 42 steel companies to go bankrupt, 17 of which had to liquidate, which resulted in over 210,000 retirees losing their medical insurance. Is that establishing justice? No. I don't think so. And then, after negotiating benefit trusts with those companies, my union did that, to provide for retiree health care, and then having President Bush lift the tariffs on foreign steel 18 months early, putting at risk the profits of those steel companies and the trust funds that were negotiated, and putting at risk the medical insurance for over 200,000 retirees. Is that an example of establishing justice? No, it's not. When I retired from NIPSCO, I felt secure in my retirement. Today, after seeing hundreds of thousands of retirees lose their medical insurance and part of their pensions, I don't feel secure anymore. And that's a darn rotten shame. My medical insurance premium has gone up 65% in the last 2 years. It has more than doubled in the last 5 years. And believe me, NIPSCO contract with the Steelworkers Union is coming up May 31st at the contract expiration. And I fully expect that lousy stinking company to try to do something to my retirement after giving up all those wages for 33 years and other benefits and contract language so that I can have that and have a secure retirement. They're going to try to take it away. I know they are. Watch for it in the papers. I can almost guarantee it because they want to be like every other stinking corporation. 5 years ago, I didn't know anyone without health insurance. Anyone. Today I know thousands. There's no doubt that the healthcare system in our country is broken, and the only way to solve the problem is by some form of universal health care. some form. There seems to be no end to the high cost of prescription drugs, and people are suffering. Affording life-saving medicine isn't a game. There shouldn't be winners or losers. I saw in the news a couple days ago that health care at some hospitals is being rationed. What's wrong with our government when it allows that kind of thing to go on? Where on the list of family values do you find that? Everyone in this great country should be entitled to health care without the worry or the stress brought on by not knowing if they'll be able to afford it. When I was in the Navy, when I got sick or went to the hospital, my treatment was paid for by someone else, not me. I didn't have to reach for my wallet. I didn't have to fill out any forms. Those of you in the military, you know that that's true. You didn't have to worry about where your health care was going to come from. You had it. Listen to these statistics. Medical prices are rising at 3 times the rate of inflation. Administrative costs are 25% of all health care spending. 65 million Americans don't have prescription drug coverage. Prescription drug costs are increasing 17% every year. 18,000 Americans will die prematurely this year due to the lack of health care. 232 Americans lose their health care every hour. And 12% of Hoosiers, right here in this state, have no health insurance. That's 694,000 people. So many retirees have lost their health care coverage, and those who still have it have seen their premiums and co-pays skyrocket through the roof. President Bush just recently pushed through a Medicare prescription drug plan that will provide too little help for most retirees and is designed not only to dismantle the Medicare system, but provides incentives for companies that do provide a prescription drug benefit to drop that coverage. And it does nothing to hold down the rising costs of drugs. If policymakers were to implement a universal health care system in the United States, we would be better served. A system that includes everybody, is comprehensive, and keeps the costs down. Until the United States has a universal health care system, until they do, all attempts to resolve health access problems affecting Medicare beneficiaries, as well as the uninsured and others in this country, will continue to cause an increasing amount of problems. Increasing problems. We do have one option. If it wasn't so darn cold, we could go to Canada and live. The total health care spending in Canada is half what it is here in the United States. You know, you hear a lot of myths about Canadian health care, which they call Medicare. Canadian health care, you hear all this bad stuff about it. I'll tell you, I've met a lot of people from Canada, a lot of people, and I've not ever heard one of them speak badly about their health care system. Not one. In Canada, all citizens have medical insurance. In the United States, 1 in every 7 are not covered. That's about 45 million people. I can remember going to a community services conference maybe 15 years ago where it was like 40,000, or maybe even less. 45 million people, and even more than that are underinsured. Canada is number 2 in the world for life expectancy. And we brag about our health care system in the United States. What do you think it is here? 25th. We're 25th. A baby born in Canada today will live 2 years longer than a baby born here in the United States. 5 years longer in Japan. We treat access to health care as if it were an everyday commodity, like going out and buying a new tractor, or a set of golf clubs, or a vacation at some seaside resort, or a new bass boat, to be distributed only to those who can afford it. Health care is not a commodity. It is a right. And today there's too much profit in it, too much greed. And the only way to solve the problem is through the legislative process. So, it's up to all of us to elect only those people who will work toward fixing this broken, unfair healthcare system. And that's the end of my little report.
How in the world do letter carriers fit into healthcare? I'm going to describe something. Charlie was up here talking about retirees getting health insurance. Retire, you work, you have health insurance, you retire. The company decides, hey, we don't want to pay into that no more. Bam, you lost your health insurance. We hear about companies deciding, hey, we can't afford, we're going to dump health insurance. I'm going to describe to you a health insurance system. It covers over 8 million people nationwide. Covers you while you're an active employee. Covers you, your spouse, and your dependents if you're an active employee. Covers you when you become a retiree. Covers your spouse when you become a retiree. If you decease, it continues to cover the spouse, he or she. Continues in that health plan. This health plan includes scores of different insurers. Includes for-profit insurers. Includes non-profit insurers. It includes gigantic plans like Blue Cross. It includes little local plans. It includes plans that cover the entire nation. It includes plans that just cover some regions. This plan also allows you to change your insurer every year. You can decide to go from a managed care plan to a health maintenance organization because you found out that the HMO in your area is going to do this, this, and that's better for your family. So you switch that year and you go into an HMO type insurer. It does that every year. What is this mysterious health plan? Anybody got any idea? It's the federal plan. It's called the Federal Employees Health Benefit Plan. It was established by a law in the early 1960s. It's been in operation, therefore, since the early 1960s till today. And it covers all U.S. Postal Service employees. We're a big employer, 700,000 active employees. Covers everybody in the federal sector. Anybody who works for the federal government. If you work for the Department of Defense somewhere, you participate in FEBA plans. You're a member of Congress, you participate in FEBA plans. Your staff is in a FEBA plan. When the Clinton administration back in the early 90s, 93, were trying to come up with a national health plan, you heard the right-wingers jump out there right away. Oh my God, you couldn't possibly have a national health plan. You'd have a tremendous bureaucracy, be the biggest bureaucracy in the world, be worse than something in Moscow or something. That was the scare nonsense they put out there. How big is the bureaucracy that runs the Federal Employees Health Benefit Plan? You know how big it is? There's a little subdivision in the Office of Personnel Management. There may be maybe 100, 200 people who run the entire thing. They run a plan that covers 8 million people, changes insurers every year, allows all kinds of insurers in and out, lots of free choice, with a small bureaucracy. Where did this nonsense come from? That we couldn't possibly have a national health plan in the United States because, oh, there'd be the evil bureaucracy that'd be controlling your lives. It would be so cumbersome it couldn't possibly work. It'd be unbelievably expensive. The FEBA plans generally, granted, they see increases in premiums. Healthcare is a problem in the United States. They see increases in premiums. Generally, those increases are below what's happening in the private sector. Why? Because they're negotiating for a large group. They go up to Blue Cross and they say, yeah, you want in on these plans, you know, covering 8 million people? And of course, Blue Cross is very interested in that. They're going to have to tailor their premiums to what OPM says is reasonable, and they keep the cost down. The same phenomena that go on with drugs under Medicare. But back to what is possible and what is not possible. What we're talking about, and what we've been talking about for over 10 years in this country, is something that is practically at our hands. Why isn't it possible? Because there's a lack of political will, and there's a lack of political vision, and also because those who are opposed to that kind of change can control how we think and talk about it. How in the world in the early 90s we got so sidetracked over that nonsense about, what were those commercials that the right-wingers put on about Louise and Harry talking about how horrible national health would be, when the very members of Congress who were opposed to it, they were participating in a plan which was quite reasonable. Back to the early 1960s is where FEBA goes. For-profit plans and non-profit plans. A lot of the federal sector unions, my union, National Association of Letter Carriers, they offer a health insurance through that. They're a nonprofit. They don't do it as a profit-making activity. Early in the 50s, the NALC began to offer a health insurance plan. So in the early 60s, when members of Congress, back then we had some vision in this country, said, well, there should be a health insurance plan for federal employees. Nonprofit groups like NALC became one of the insurers. They now offer health insurance nationwide. As I mentioned, Blue Cross offers, Aetna, Metropolitan, it goes on and on and on. It is possible. It's practical. It's real. It can happen. But it's the lack of political will and vision that keep us held back. Charlie mentioned Canada. They have a national health. Well, you know what? He could have mentioned every country in the world. Every advanced industrial country. We're not talking about the poor sub-Sahara nations that don't have extensive social services. But every modern nation has a national health plan, except for the United States. So it's not impossible. The world doesn't come to an end if it does happen. I think, I like to bring up this tremendous contrast. Here's the federal sector with this massive national health plan, but those who set our policy, who talk against it, they participate in it and pretend that this doesn't exist. Couldn't possibly happen. The one I love the most is, of course, it'd be a tremendous bureaucracy. You can't even find the office, the sub-office in the Office of Personnel Management that runs the FEBA plans. No, it's not a big disaster. It can happen. So that was one reason I wanted to speak, is to tell fellow unionists that, yeah, it is possible. But here's another problem about political will. Even though the FEBA plans are quite successful, there's an issue about writing legislation about how the Postal Service will be operating in the future. It has to do with the rise of the internet and some changes in business, that there's going to have to be some changes in the Postal Service. Not much progress has been made on coming up with new legislation. The Bush administration decided to appoint a presidential commission to come up with recommendations on how the Postal Service would operate in the future. So President Bush appoints, about 4 or 5 of them came out of Texas. You can bet on that. You figure out what their backgrounds are, but we don't want to go into details. One little detail came up out of one of their recommendations. They proposed that the Postal Service be withdrawn from FEBA, and that so that the Postal Service can just negotiate directly with its with the unions who represent the employees in the Postal Service for an outside health insurance plan. This is a totally unacceptable idea to most people in the federal sector in our union. But what's embedded in this is this notion of breaking up health insurance plans, breaking them down where they exist, where they work. Now, I'm sure this recommendation is not going to find much support on Capitol Hill. The federal sector and postal unions have a lot of friends on Capitol Hill, and I don't think they're going to be interested in pulling 700,000 relatively healthier active employees paying into a health insurance system to make it smaller and more vulnerable to market changes. But it shows that it's a question of political will and what we're willing to allow our officials to talk about. Why in the world would a commission in 2004 come up with the idea of breaking up a health insurance system when what we want are insurance systems that work better? So that's something I wanted to bring to everyone. Number one, it is possible to have a national health system that is workable, that is not a big bureaucracy, that allows choice. There's a reality. It does work. There's one that was a model. And 2, it's up to us to make sure that our elected officials talk about what's important to us and not some nonsense that they go off into. So, thank you.
Yes, they would. Yes, they would. The answer is
Weren't those terrific speakers? The Greens have from our very beginning, in all of our platforms and in everything that we do, we're looking for a just, sustainable society, and universal health care here in the United States is absolutely necessary in order to have justice and for our society to be strong and move into the future. You know, it's a lot easier to be green than you think it is. And we invite you to join with us in supporting universal national health care. Also, we really appreciate all of our viewers. Thanks for watching GreenTV. See you next time. This is Tom Brown for the St. Joe Valley Greens.